Good afternoon, everyone. My name is Rachel Cotton. I'm the Community Resource Developer and Perkins Grant Coordinator for the Delaware County Technical High School. I want to welcome you all to the Medical Careers Open House. We have all of our teachers with us, as well as some DCTS staff that I'm going to introduce. The first person I'd like to introduce is Dr. Stephen Butts, our director.
Hello, everybody, and welcome to our virtual open house for medical careers. We do have two of these presentations, so I appreciate our teachers, our staff pulling this together, and all the parents and students that are on to get information. So I'm excited about this. Over the next hour, you'll hear about medical careers, and hopefully everybody will be interested to apply and consider our medical careers program. So thank you very much.
Perfect. Our next person to introduce is Dr. Linda Lomas, the Supervisor of Student Services.
Good afternoon, everyone. Thank you very much for attending today. My role with the technical school is Supervisor of Student Services, which means overseeing school counseling, special education, the academic teachers, and the co-op program. And I also have a bit of a hand in the admissions process. So if I can help with any questions, but I know that teachers are going to do a great job of explaining that to you.
Perfect. And our last administrative is our principal, Chris Hansen at the Aston campus.
Good afternoon, everyone. I supervise a few of the teachers directly for the medical careers programs. Those would be the teachers who teach at Lankenau, Bryn Mawr, and Riddle Hospital.
Perfect. Thank you so much. He actually just joined us. I'd like to introduce Mr. Dan Palmer, the principal at the Fallcroft campus. Oh, Dan.
So he may not have heard that.
Hi guys, good afternoon, welcome. I'm sure you'll learn a lot of information today, hopefully finding it very useful, and we look forward to seeing you.
Perfect, thank you so much. Before we start introducing the teachers, I do want to remind everyone that this will be recorded and put on our website as well. So if you miss any parts of it or would like to go back and review it, definitely make sure to check out our website. I'm going to pass it off to our first medical careers teacher, Mrs. Sarah Connolly Smith.
Hi, everyone. My name is Sarah Connolly Smith, and on behalf of all the medical careers teachers, I just want to welcome you again and thank you for joining our open house this afternoon. During the next hour, we have a lot of information to provide to you about our curriculum, our clinical shadowing, patient care skills, learning opportunities for the students, and we hope at the end of our presentation, you'll have a deeper understanding of our program and be able to make a more informed decision about whether our program is right for your academic path and perhaps your future career in the healthcare field. So with that, I will begin by just letting you know that medical careers is offered to students that are interested in pursuing post-secondary education to prepare for a career in the healthcare industry. And if that student doesn't necessarily know which career they are necessarily interested in the healthcare industry, that's okay. We're here to help with that as well, with career exploration and through clinical shadowing, able to offer some assistance with that. We do have partnerships with many different medical facilities within Delaware County, and they're all listed there. Includes Mainline Health System, Delaware County Memorial Hospital, Chester Crozier System, and Taylor Hospital. Oh, and Mercy Fitzgerald. Our classes, we have two sessions, a morning session that's 7 to 9 and an afternoon session from 12 to 2. Our classes are every single day, Monday through Friday, again, either at 7 to 9 or 12 to 2. And no matter what we're doing, whether it's a theory day, it's a clinical skills day, or you're shadowing, your class will always be during one of those two times. The session that you will be accepted into really depends on your schedule and how that fits in with your school. So certainly check in with your counselor to see how your scheduling is all going to unfold and what your ultimate schedule looks like within your school. Our current sending schools, we do have the privilege of teaching students from many different sending schools across Delaware County, and that's just a wonderful opportunity, not only for us to interact with many different school districts, but for students as well to interact with neighboring school districts and get to know different students from different districts. Our curriculum is divided into 3 different areas. We have academics, clinical rotations, and patient care skills. We have a lot to cover in a year. It's a lot of information, so much to learn, and because of that, school districts do offer honor level credit for our class. If you have questions about that, certainly see your guidance counselor about the honors level piece. Specifically talking about academics, what are we going to cover in our academic content? Well, there's a lot of anatomy and physiology. And if you are taking anatomy and physiology as a junior or are planning to take that as a senior, that is wonderful. We will take what you have learned and we will expand on it. We bring in pathophysiology and talk about the physiological changes that happen within the body resulting from disease. And that needs a strong anatomy and physiology foundation. So we will take what you have learned and expand on that, and it works flawlessly together. If you haven't taken anatomy and physiology, that's okay too. We start from the beginning, the basic structure and function, and we work all the way up to learning blood flow through the heart and everything else in between. Medical terminology and medical abbreviations, these are ongoing part of our curriculum throughout the year. We start with medical abbreviations, and then we move on to medical terminology in the late winter and spring. I will say medical abbreviations is a favorite among students. Just a little background about medical abbreviations. It's not just learning. I'm going to use examples for N abbreviations because that's what I just covered. NC stands for nasal cannula. And yes, there's memorization. This abbreviation stands for this, but we also expand on that. We'll look at a nasal cannula. We'll put it on a mannequin. We'll look at a clinical scenario. We'll perhaps a student saw a patient with a nasal cannula in a clinical situation, shadowing. So we'll discuss that as well. Another example, another N, NVD is neurovascular disease. We'll understand that that's what that abbreviation stands for, but we'll discuss some of the diseases that fall into that category. We'll discuss aneurysms and strokes and maybe pull out a case study and watch some videos and understand that. So it's a lot more than just understanding and memorizing abbreviations. As well as I will point out that you will be able to understand so much more of any medical show that you choose to watch on television when they're talking about a CBC or NPO or PIV. They're going to just be beaming that you understand all these abbreviations. All right, moving on to certifications. We are able to offer many certifications to our students. OSHA 10 is Occupational Safety and Health Administration. This is a 10-hour course that results in a safety and health certification. This is good for 5 years. And I will say, I just got recent feedback from a student last year that used our course and what we learned, as well as her OSHA certification, to secure a part-time position while she was taking her freshman classes from home this year. So she was really excited about that. We are able to offer American Heart Association certification in BLS, CPR, and first aid. And this is the real provider training, the training that I received as a registered nurse. It's not your run-of-the-mill certification. This is the real deal with American Heart Association. And as well as the NOCD Health Assistant. Students are able to take our standardized testing for career and technical education in health assistant as well. Moving along, we also include some health sciences topics such as safety and infection control. Safety, we talk about patient safety, body mechanics. Infection, there's no more applicable unit than infection control. If you could go back one slide, Rachel, for me, please. This year, talking about viruses and bacteria and the immune response and development of vaccines. So very real world relevant to what's happening all around us. Law and ethics is a great unit we usually cover in the spring, talking about how law and ethics pertains to patients, our role as healthcare providers, and that always generates a lot of good conversation among students. Communication in healthcare. Healthcare providers are one of the most trusted professions. So our communication skills need to be something we continue to work on with each other, with coworkers, with our patients. So we cover that. Everything we cover from the beginning of the year to the end of the year really prepares students for secondary education and or a career in healthcare. One other piece that I'll also add, we have a very robust guest speaker program. We've added a lot of professionals this year to our panel of our regular guest speakers. And these speakers are wonderful. They will come in and share their career paths, how they got to where they are. They will share their expertise in their field, in addition to adding relevant information to the curriculum that we're discussing. So that's just another wonderful addition to our program. Okay, and I think Mrs. Barakat, this is your section.
You have to unmute yourself.
Thank you. Sorry about that. I'm Mrs. Barakat, Ro Barakat. I teach the program over at Crozier-Chester Medical Center. And probably the main reason a lot of students apply for this program is the clinical rotation piece of our program. We're in 7 different hospitals. This year, because of the pandemic, we're not in clinical rotation. So we're trying to do a lot of things to make up for that, with mock clinicals and things like that. The guest speaker program is fabulous, but hopefully next year things will go back to normal. But in these clinical rotations, the students shadow. I know you've seen a lot of pictures so far in this PowerPoint. It's not like that now. Our students are socially distanced, but when they are in the clinical setting, they could be anywhere, and we go with them, but then they kind of just go on their merry way. We have a schedule. They might be in the operating room one day. They could be in the emergency room. They could be in oncology. They could be in the cath lab. So there's many, many places they can go to. So when they shadow, primarily they're shadowing nurses. But if they're in the GI lab, they're going to be watching one of the GI docs doing an endoscopy or a colonoscopy or something like that. So they get to see doctors, sometimes PAs, nurses, anesthesia, things like that. They do get to watch some patient care procedures. I've had students who have been in the OR for open heart surgery or for brain surgery. Some of the hospitals, they can actually see births, C-sections, or vaginal deliveries. They get to interact with the staff and the patients, and that's why communication is such an important piece in our curriculum, because if they are out in the clinical setting, they need to know if someone's talking in that medical lingo, they need to understand. So it's primarily observational. They're not doing anything hands-on. When we do go to clinical, it's 2 days a week, and that differs according to the hospital. I've had to change my days because the OR has their staff meetings on a certain day, so I'll change my clinical days. Journaling, when they do go to clinical, they are responsible to write a journal. I ask for 1 page, tell me what you learned. And probably more than half of the students are giving me not 1 page, but 2, 3, and I've even had 4-page journals about the scope of what they learned in that clinical day. Okay, I'm done on that side, if you could, thanks. And then these are just some of the areas that they go to. They'll go to all the nursing units, like I said, operate the OR, ER, pharmacy. If we have a student who's interested in pharmacy, sometimes they'll say, because they're usually 2 days in each unit. But if someone says, I know I want to be a pharmacist, I don't really care to go to PT or OT or like the nursing floors, then I'll try and get them extra days in the pharmacy, the ICU or your intensive care units. And we've had a lot of students who are interested in radiology, whether it's the to be a physician, a radiologist, one who's reading these tests, or to be the person who's performing the test. So Crozier actually has a rad tech program, but there's other institutions that do as well. And my PowerPoint seems to be cut off down the bottom, but it's still, and these pictures are just students that are in clinical. So, and that picture there with just the bay looks very empty. Sometimes they go to clinical and it's really, really slow. It looks like that. And other times people are like whizzing around you. So can't dictate how that's going to be, but okay. And then just more areas that they go to: respiratory therapy. We've had some great guest speakers who have come from different programs, but respiratory therapy, the cardiac cath lab. And remember, we're in community hospitals. I've had many parents of students who work in these hospitals. They see what the students are learning and they say, I want my son or my daughter to do that program. So my students were in the cath lab one day. I had two students together in the cath lab, and one of the doctors, one of the cardiologists who was doing the cardiac cath, saw the kids in the control room, and they went to school with his children at the high school. So he aspirated a clot from somebody's coronary artery, blew it into a gauze pad, and handed it to the nurse and said, can you go out and show those students what was causing, oh, my lights just went out, what was causing this person's heart attack? So we're in the community. They see people that they know, people grab them and say, come watch this. So yeah, so OB and pediatrics is one of the rotations, except in some of the hospitals. Not every hospital has these. You can go on to the next, Rachel. And I think I'm passing it off to Laura.
Thank you, Ro. Good afternoon. I'm Laura Woolhoff. I'm a medical careers instructor assigned to the Riddle Memorial Hospital site. And yes, as Ro said, our students do have a great many opportunities once we're back into the hospitals to see all the different areas of the hospital. But at the same time, when they're in the classroom with us, we're introducing the students to many, many patient care skills. Throughout the year, the students will learn and practice all of the patient care skills like you see here, taking vital signs, height and weight, how to transport or transfer patients. As Sarah alluded to earlier, infection control has never been more prominent than now. Students are given a skills bag at the beginning of the year, and it has for them their own blood pressure cuff, stethoscope, PPE. We do a lot of practice with putting on PPE and taking it off in the proper order, and things like hand washing and various other skills that they need to know as far as patient care. We also not only take the time to discuss with them the fundamentals and demonstrate and do some return demos, but give them plenty of opportunities for practice, and then taking it to the next level of developing the higher level thinking skills, critical thinking skills. What do we know based on a high blood pressure? What are the implications of a patient? And what are things that we need to think about that this could mean, outcomes for our patients that we care for. I think that's a picture of some of the students in our past clinical experiences and the skills that they've learned. The sim mannequin, taking some heights, weights, blood pressure, again, giving them several opportunities to practice. And we encourage them to practice at home too on their parents and their siblings. Again, mapping out the blood pressures and seeing what the implications are. Many of our students that come to us, some of them know what they want to go for, some of them still aren't sure, but the intended careers, any student that's interested in our program, many of them want or are interested in becoming nurses, doctors, surgeons, physical therapy and occupational and speech therapy. As Rose said, some of them are very much interested in pharmacy or research. And then things like medical technology, physician assistant, even a lot of them are interested in dentistry as well. So we really do try to provide them, whether it's in the clinical setting or the classroom, really introduce them to a wide range of medical careers. And I think, Ro, is it back to you?
Okay, sorry about that. Yeah, so life after high school. So we boast 100% college placement. All of our students are headed to either 4-year programs, some 5 or 6 if they're looking at, pharmacy or PA. And we help them with that. These kids are really good. We're pretty well versed on college, but we're not guidance counselors, but we do a pretty good job of helping them kind of navigate through that. Some of them, occasionally we've had people go to Delaware County. I'm a Delaware County alum that went on to Westchester, but can't speak highly enough about it. So we do try to track our students, after they graduate. Social media is a great way to keep in touch with them. They'll friend request, and they love to share their accomplishments. I'm working here. I think we did a survey and about, I think it was like 80% were still in healthcare, because that's the beauty of this program too. Some students come in and they say, what, I know that I want to be, a nurse, or I know that I want to be a physical therapist. And then they come in and they say, what, this really caught my eye. And that's okay. It's, rather than spend all that money and time pursuing a career that might not capture their interest down the road. So, and sometimes they discover that healthcare isn't for them, which is just as important. So, yeah, if you could just give me the next slide. And then additional student activities. HOSA, this is that Health Occupation Students of America. Just like your home schools have, FBLA, the Future Business Leaders Association. This is a student-led organization, and in non-COVID times, it's a wonderful way for you to meet people across the state. And then if you win, there's events that take place like medical spelling bee, medical math. Medical terminology. If somebody's a really good writer, they could do extemporaneous writing. But it's a great organization, helps with leadership skills, things like that. We also have the National Technical Honor Society, just like your homeschool has an honor society, so do we. The criteria to get into it is pretty steep. You have to have a 95 or better in your medical careers program and at your homeschool classes, and no more than 1 absence per quarter. But it's a great honor. And then we have graduates return. Last week I had one of my former students came back. She's an OBGYN at Brigham and Women's in Boston, and she was a guest speaker for us. So, and sometimes they like to just come back and talk about their college experience, and they help students kind of work their way through that. Some of the students are hired in entry-level positions. Our students they need to do a portfolio, and I've had 2 students come back to me and tell me that they were up for a job. One was down at Hahnemann, which is no longer, but he said the reason I got this job was because I brought my portfolio in. I showed them my portfolio, and they were so impressed they hired me over somebody else. So, yeah. And I think this is you, Rachel.
Yep, this is. Thank you so much. So we offer several different types of college credit, whether it's dual enrollment or 2 different types of agreements for students to continue on with automatically earning college credit. So one thing that we have is called Students Occupationally and Academically Ready, also known as SOAR. These are agreements across the state of Pennsylvania. So with collegetransfer.net, you can find a list of schools and a list of the equivalency courses that they'll be able to take. We work with like Penn Tech College, Harrisburg Community College, a lot of technical schools without Pennsylvania, community colleges, and so many more. They'll be able to provide to you a list of different equivalencies. Students can earn a minimum of 6 college credits with this program. Some schools, depending on their equivalency, can offer almost 18 college credits. So it really depends on the type of school that you're going for and the type of degree as well. But collegetransfer.net can provide more information. They are also listed on our website as well, so you can find out more information about the SOAR program too. Our next college credit opportunity is dual enrollment. So we have several different dual enrollment opportunities. Immaculata is one that we've been hosting for a while now. With medical terminology, they get 3 college credits for completing that for dual enrollment that they do. And then this year, we actually started a new agreement with Widener University, which this is offered to all of our students across Dcts. And these are our current offering for the 2020 and 2021 school year. So the dates that are listed right there, we just started our spring one today, which is super exciting. So these are all new classes that students can take. By the time they graduate with us, they have the opportunity to get as many credits as they need to. They can honestly earn up to 30 college credits, depending on how many classes that they end up taking within the offering. These do change every year, so these classes will be very similar to next year, or they'll be the same, or they could be different. We follow the Widener curriculum for courses that they're offering and willing to allow DCTS students to participate. The dual enrollment credit are heavily discounted compared to being a full-time undergraduate student. I believe with Widener University, it is $200 for a course, not per credit, for a course. So that's definitely very discounted compared to maybe paying almost $3,000 for a course at their university during their undergraduate degree. So definitely take advantage of this if they can. They'll do it as an online program following the curriculum that the professors set up for them and the deadlines that are provided as well. But definitely take advantage of it if you can. I know that a lot of our medical careers take advantage of the dual enrollment. I know a lot of your students have signed up for the dual enrollment, which is amazing that they're already earning the college credit to be able to get a head start of their college courses, their general education courses that they're going to need, and so much more, and seeing if the college classes are a good fit for them as well, which is awesome. And I am going to, I missed it. There we go. I knew I was missing a slide. Another type of agreement that we have are called articulation agreements. So currently, these are the colleges that we work with that partner with us, that the students can earn the college credit right after they graduate. So we have Newman University, Pittsburgh Technical College, the University of the Sciences in Philadelphia, and St. Francis University. So I put an example of how these credits work. They're very similar to the SOAR credits, where they just have to complete our program. So for this one, for Newman University, medical career students have to complete their task list, the NOCD, and the CPR and AED. If the students complete that, they're able to go to Newman University and earn 6 college credits. The same will be for the Pittsburgh Technical College, University of the Sciences, and St. Francis as well, for the things that they have to complete with our program. So it's really cool that these students are earning college credit immediately as soon as they graduate, or starting to take the courses with our dual enrollment program as well. So I'm actually going to pass it over to Jamie, and thank you very much.
Hi everyone, my name's Jamie Damaco, and I am newly to the program, but I actually was a student of DCIU myself, and I'm glad to be a part of the program. Now on the other side, I am with the Taylor Hospital location, and I just wanted to kind of reiterate what Sarah had started about the wonderful guest speaker program that we have. You can go to the next slide, Rach. So usually we had, prior to COVID, we had guest speakers come into the classroom, and unfortunately, maybe didn't have as many just because they had to travel, but we've had a really good experience this year with the option of Zoom. We've had a lot of different guest speakers, which has been an awesome plus in light of the situation that we're in with COVID, because these students have really gotten a wide variety of medical professionals where they might not have necessarily we've really brought in and been able to touch a lot of different aspects. So hopefully we can continue that even when we are back in the hospital setting, because the students have really enjoyed the guest speakers. This one specifically, this is a PA from Lankenau that is actually teaching the students how to suture an incision, which is absolutely awesome. We've had guest speakers ranging from, we recently, last week, we just had a neurosurgeon. He was awesome. He actually had live footage of brain surgery. We had somebody from Chester County Health Department, which was an exception for what we're going through now. Even the teachers learned a lot of information as well. We had Director of Patient Experience down at Penn Presby, which is another great thing to see the patients. Being a medical professional, it's really nice to see the opposite side from a patient perspective as well, because you need to know how they feel of how they're getting treated. But with that being said, guest speakers is an added plus, because you really do get, if you're not sure of exactly what you want to do, you really do get a wide variety of experiences. Hearing these, you hear their in and everyday life of their daily job. So it really is a great added plus to the program. Do you want me to continue? We offer CPR, BLS certification. So these are the actual, we test them on, we have mannequins. We actually just, each site now has a really, really nice mannequin. But as well as CPR, we have somebody that comes in, and we have dummies for everybody, and you get the real life experience and certification. Celeste, I think I'm going to turn it over to you.
Yep. So again, with COVID, we can't do as much of this volunteer experience, but in the past, our students have been asked by the hospital administrators, some of them just the coordinators, the EMS coordinators, to be part of the local disaster drills that they have at the area hospitals. And these were great experiences for the students. They were given little slips of paper of what was wrong with them. I think the last one was a I think it was a chemical spill and fumes coming out at a building that my students participated in. I'm at Delaware County Hospital. And some of them really got into it. They did a lot of acting. They really liked it, but the staff really enjoyed it because it really helped them to, know what, like, figure out what was going on with this patient. It's helping the staff learn, like, thinking on their feet, like quick things like, all right, what does this patient need? Have they been contaminated? What else do they need what do we need to do to help them? So it was a great experience for my students. And I think Bryn Mawr's participated in it. I think Crozier and Taylor. So those are just pictures of the students being brought in, and all the staff kind of standing there evaluating them, and they have little check boxes, and like these are all of their stickers. So when they get sent to a room, they know who's where and everything. So that was really good. I think we're on to the next one. This is just another view of it, of them being triaged. And this is them just kind of waiting, hanging out for their next turn. So this again is, I guess, a picture of more surgeries. Like we said, lots of opportunities to learn, again, through the guest speakers. And we have a lot of patients that, or the students are allowed to participate in the grand rounds. So where the doctors are actually sitting there and talking and going through cases, our students are able to sit in on that. They can also, that's at Crozier, and then they have the Schwartz rounds at the mainline hospitals that they can talk about and sit in and just hear the doctors, just all their critical thinking and what else could we have done with this patient. Sometimes, unfortunately, the outcomes aren't very good. So they'll talk, what could we have done? What, in hindsight to make this care a little bit better, or, what was going on. The next slide. So this is HOSA. So that is the Health Occupations Student Association. So actually Sarah or Ro might be able to jump in and talk a little bit about this more, about what they do here. This is just a picture of all of them in their competition. Again, I think this year it's going to be virtual. Usually they go to either King of Prussia for the state, and then sometimes the national conferences are either in Texas or Disney or someplace, but I think this year we're doing virtual again. Is that correct? I believe.
That's right.
Yeah. So do you guys have anything else to add for HOSA or?
No, this conference, I think this was the state conference, and if they win at states, then they get to go. Sorry, my lights went out again. Then they get to go to the national conference. But we've been to, Nashville, Disney, but it's very, very competitive. I know when we went to the states conference, there was about 800 students, and if you win at states, if you medal, like bronze, silver, gold, then you go to nationals, and there's about 3,000 students from across, like high school students from across America that go. So it's very, very competitive, but it's a lot of fun. It's very professional. They have to wear a suit, and they're in that suit. They have to go to breakfast, lunch, and dinner. It's very, and you know what? It's funny when you go to the hotels, the workers remark on just how professional these kids are. There's something about wearing that suit, I think, that makes them even behave more professionally, when you're in that suit. So sorry, go ahead.
I think I'm turning this back now over to Laura, correct?
Yes. So I'll just mention this briefly. Rosemary did earlier talk about the National Technical Honor Society. So the students, as being part of the Medical Careers Program, have the added benefit of joining this National Technical Honor Society in addition to the Honor Society that they would join at their sending school. Students who are part of this organization, the NTHS, it helps its members apply for scholarships for post-secondary education. It earns them the recognition for superior achievement in their career and technical field, connects them globally to networks, and helps them discover opportunities in the leading industries. So as Ro mentioned earlier, students do have to meet the academic requirements, and they have the opportunity to apply to be a part of the National Technical Honor Society during our program of their senior year. This program also offers the students the opportunity to meet new people, both in the classroom and in the clinical rotations. Sometimes in the classroom, they may be in a room with students from other sending schools. Students over the years have commented about how they have created and developed long-lasting friendships with their peers, and even just meeting some people out in the community and in the hospital in their clinical rotations. So developing these lifelong friendships and support systems that will carry them through their future years. Students also, this is an example where students have an opportunity to reflect on their experiences at the end of the year. So we give them several opportunities to reflect on what they've learned throughout the year, but at the end, give them that time to see and share some insight into what they've learned, what they've experienced, what they have found beneficial from being in the program, and what, especially what they've learned out in the clinical rotations to bring with them to their next step in their educational goals. There's a picture of them in their personal protective equipment. And I think I'll turn it back over to
me.
Celeste. Thank you.
All right, so this is our admission kind of breakdown. So definitely, if you're interested, go to see your counselor. We are hoping to have our applications in by the end of February, so February 26th. There is a DCTS application, and then there is a separate medical careers and a supplemental application. There is an essay, and again, there may be an interview process. We're not sure. It may be a Zoom, it may be a phone call, but areas that you really need to be aware of is your GPA. We do require a GPA of 3.0 or higher. We need to see that you've taken bio and chemistry. That is a prerequisite for this course, and we'd like for you to have a B or better. Your rank, your absenteeism. This is you learn a lot. You learn if you miss a couple of classes, you're missing a lot. So we really like you to be committed to this and to really want to participate and to be, with us. If you're sick, you're sick. But if you just aren't having a great day and you just are sleeping in, we really want someone to be committed. Disciplinary history. So we really can't have anybody in the program who's had issues with disciplinary items. It's more the hospital that's a requirement, because like Ro was alluding to, when they go out to clinical, yes, we'll walk them up there, but we're not standing there with them. I mean, we have 12 students throughout the hospital and we're walking around and we're checking on everybody. So if there's any kind of issue with them, we're not there all the time. So they need to be on point. We do look a lot at extracurricular activities, sports, anything from sports to theater to music to choir. If you're on your National Honor Societies, there is an essay. And like I said, there is an interview, potentially, depending on COVID. So we would like for you to apply, now. Your counselors will have the applications. So you apply winter of your junior year. Again, interviews may potentially be April, May, maybe a little sooner, and decisions early June, but we might even be inching that up a little bit more, because I know scheduling, it's a lot for your counselors to be scheduling and to fitting you into our program. So we do our best to try to get things to them as soon as we can. I think we're moving on. Next slide. Okay. Also, since they're going to be in the hospitals, we do require a criminal background check and child abuse clearances. There is no fee for this. You also need a physical examination. We just need to know that you've been vaccinated. Definitely some of your vaccinations, and we do require a TB test. And we do, I don't know if that's on here, but we do require you to also get a flu shot. And again, that's more the hospital's protocol, not so much us. Any worker in the hospital, you have to have a flu shot, or anywhere in healthcare. So you will get a big packet that you get over the summer. And usually that first day when you meet us, we just kind of go through it. You bring it to us. And, we just sort out all your paperwork. There is a dress code. And again, that's the hospital. They want to make sure that, you're represented. So the shirts are a nice polo shirt, and they have DCTS, DCIU, and it says medical careers. We actually changed the uniform this year. It's like a nice, like light blue. There is also a track jacket available, because if any of you who work in hospitals know, hospitals are always freezing. So we do allow you to wear that jacket. We don't allow them to wear hoodies or, there are other instances of, no crazy hairstyles, piercings, we'll ask you to remove some of your piercings, any visible tattoos, we would like those covered up. And then, just normal sneakers, tennis shoes. So again, there is our website. So you can definitely visit us on that. And this recording will be posted to that. If you have a friend who couldn't make this right now today, or, then one next week, they can always look at this and hear all our information. I guess the next slide is, so then any questions, we've kind of designated Ro to be the one who would get any questions. We're definitely going to do questions and answers now, but anything else that you think about, like, oh, I totally forgot to ask that, definitely copy down this email address, and she'll, ask us, and we can we'll get back to you, or she'll get back to you. We're not going to make her do everything. We're a team.
Fantastic. I want to thank all of the medical careers teachers and all of our DCTS staff right now. If you do have a question, please feel free to drop it in the Q&A chat, or please feel free to put it in the chat box. Our first question is, if my child is interested in pharmaceutical chemistry, which program would she gain the experience? Would any of the teachers like to jump in on that? Is that a possibility?
wants to be a pharmacist, I mean, like we said, we can have them do a rotation down in pharmacy with the pharmacists, and you know, that's a great experience. So yeah, I mean, I would totally recommend that if they want to do that, to do pharmacy. The pharmacists at my location are wonderful. They're very thorough, and they're very they like to teach.
Perfect. If I am a junior who is taking chemistry next semester, which is next week, would I still be able to apply?
Yes, as long as you've had bio and chem prior to coming into medical career, so prior to your senior year, that's absolutely fine. I did see the question here, how many students do you usually take from each school? We don't designate like the school has so many seats. We get applications from all the schools, and we have a spreadsheet that we fill out, and you could have a lot of kids coming from one school and a handful from another. It's not like each school is not designated so many seats. That changes every year.
Fantastic. Does chiropracticing dose include with physical therapy, and is there a class with business? So unfortunately, we don't have a class with business, but would anyone like to talk about the chiropractic and physical therapy?
I've had a lot of students who have taken medical careers who have gone into physical therapy. There's a lot of anatomy and physiology and physical therapy and communication and law and ethics. Chiropractor, I suppose you could do that as well, but yeah, I mean, either one of them would be suitable for medical careers.
I'd also jump in there and just say that would be a plug for exercise therapy and sports science as well. You're definitely going to get a lot of the anatomy as well in exercise therapy and sports science. So, and I did in the chat box, I did present there that on January 21st at 4 p.m. we'll have a similar format open house for our biomedical technology and laboratory sciences, dental occupations, emergency protective services, exercise therapy and sports science and health science programs. So again, because this program, for the most part, does go to the point where you know, it goes to selection in terms of the applications. It might be a good idea to check out one of our other programs that might be a second choice for you should you not get into this program, or maybe one of the other programs might be more along the lines of what you're thinking is a long-term goal for you. So please tune in on January 21st for more information there.
Fantastic. The next question, I am a freshman and I wanted to know what is the best track that I can take to start now? So what kind of classes should they be taking at their high school?
Actually,
you're asking the right question. So that's you're making the first step right now.
I want to address
Well
that question
Well
above. Oops. This is for seniors. I guess maybe we didn't make that clear. This course is only for high school seniors. So yes, if you are a freshman, definitely start with your sciences. You know, again, talk to your advisors, your counselors, and you know, make sure that you have your bio, your chem. A lot of our students, they have taken anatomy and physiology. Some of them maybe have taken chem and bio and now are doing AP chem. Like that's totally fine. You do need to have a pretty decent biochem background to, you know, to really kind of understand some of this. Okay.
Fantastic. Our next question, how will COVID affect this program? You said this year you did not have clinicals. Are you reevaluating for next year, or have you ruled out clinicals already?
So I'll chime in here. We're optimistic that when we restart in the fall, we'll be able to be back in the hospitals. We're slightly optimistic that we'll be able to do something yet this year, this school year, in the hospital settings. However, we're optimistic that the vaccine and our wearing masks and our progress with the pandemic will improve, and we'll be able to get back into the hospital settings next year. As we get closer to that, May, June, July, by all means, you can reach out to administration or any of the teachers and we'll have an update. But we'll be posting updates on our website of where we're at, but we do anticipate for the fall we'll be closer to back in session at the hospitals. We have, through our adult nursing program, already started back in hospitals. So we do anticipate being able to get back in eventually, hopefully by September.
Fantastic. Thank you so much. Our next question, oh, it just disappeared. When considering our GPA courses attendance, is it cumulative or just this year?
We're looking cumulative. We get transcripts from freshman, sophomore, and junior year.
Okay. I've only taken biology so far. Does that mean I cannot take this next year?
Is this person a junior? Are you taking chemistry next semester?
I'm not sure
Yeah.
since it does not.
Yeah, you need to have bio and chem. And again, I know Mrs. Quigley just said this, but this is only for seniors. I don't know if everybody knows that. You apply in your junior year and you take this in your senior year.
Great.
And that's more because of the maturity. If you are out in the clinical setting and you're talking with patients, some patients are, some patients are dying and you're seeing some pretty crazy things. So the maturity, you need to be a senior to take this class.
Back to if you've only taken biology, follow up with your school guidance counselor around what your options are. We do have other health programs, health sciences, and other programs that could be a possibility, but by all means, speak to your school counselor about what your options are.
If I could chime in,
go ahead.
I just want to say that our other programs are not senior only, not 1-year programs. Those programs students can start in 10th grade.
Thank you.
Great. Next question. If my child is interested in veterinary medicine, is this program a good place to start?
I had a student who was interested in veterinary. I mean, he didn't go for it. He went to business, but that was, and it was fine because you are getting, you're getting experience with patients. Obviously these ones are talking, not like your dogs, but, or your cats, but yeah, I think it is. It gives you a good base foundation. In nursing school, you learn about the cat because our muscles are very similar to the cat muscles. So, that is a help. Rachel, actually, there was a question in the chat I wanted to address
Sure, go ahead.
about, where is it? What DCTS school does the actual classroom work happen? Again, because of COVID, we are in the schools, the actual schools, but typically we are in the hospitals. We have classrooms in the hospitals. That just it's a great experience. In Delaware County, I am like literally right next to a nursing unit. We see a lot of activity. But this year I am at Fallcroft just for, I guess, the schools that I am pulling in. I have Upper Darby and Bonner Prendy and Interborough and what's the other one? Academy Park. So just for logistics sakes, that's where I am for this year, but hopefully, next year, we will be back in the hospital. Sorry. Yeah. So.
Perfect. There's an admissions question for Dr. Lomas. I was looking at the application and saw that you had to turn in your English keystones, but I did not take the English keystones due to COVID. Is that okay?
Yes, that is okay. We definitely understand that we have to look at the applications in light of COVID. So yes, it's fine.
And along with the application, is there a format for the essay? And is there a subject matter to be followed for it?
I'm going to let one of the medical careers teachers answer that question. They have the supplemental application.
Yeah, it's very brief. It's like a paragraph. We don't want anything, you don't have to, send in a 2-page or a 1-page. It's just one paragraph really telling why you want to go into the medical field. I can't remember the question, verbatim off the top of my head, but yeah.
Great.
Yeah, don't stress over this essay. It's not like that.
Will students be required to get the COVID vaccine before the 2021-2022 program along with the flu shot?
That's a great question.
It is, and I'm not touching it.
Me either.
'Cause I don't know.
I will dive into that. At this point, I do not anticipate that. Having said that, we are hosted in hospital settings, and hospital settings may decide to require a vaccine similar to the flu vaccine. However, that is going to evolve and change over the next couple of months. At this point, we're not, one, we can't get it, and two, there's a lot of issues around that we have to sort through. We'll have more guidance on that in probably 4 or 5 months from now. We have sided with the medical careers program. Generally, we listen and have to abide by what the hospitals require. But even the hospitals right now are still sorting through what their requirements will be for staff and for volunteers. So the best you can do is stay tuned, and we'll get a better plan of action once the vaccine is more readily available and there's better medical guidance within our hospital settings.
Thank you so much, Dr. Woods. Another question: to enter the National Technical Honor Society, do we need a 95% or above in all other classes from school, along with the 95% or higher in medical careers?
That's correct.
I think it's a 3.5 GPA, right?
Yeah.
3.5 GPA at their home school.
Great.
Okay.
Is it possible to change majors? For example, you studying nursing, but get interested in medicine and you decide to change. Is that possible, or can you take more than one?
Oh, people are changing their minds all the time. Yeah, it's not like a major that you're taking. The class medical careers, this is for like you're going to be sitting in a classroom with people who are interested in going into medicine, into nursing, into PT, speech. We're all together in one class because we're not specializing in any one thing. This is an exploratory program.
If I can interrupt and to speak as a layman, because I can understand this question. And the way I look at it is if you have an interest in a medical career, this program is going to provide you with the opportunity to observe and experience a lot of different medical careers, a lot of different avenues that you could seek out to specialize in after high school. So it's giving you that opportunity to observe a maternity ward, or to observe an OR, or to observe pediatrics, or to observe pharmaceuticals. It's giving you that opportunity through the clinical experience to get your feet wet and seeing things that you might say, okay, this is a deal breaker for me. I definitely don't want to go this route, but here, yeah, I may be interested in this. I thought maybe I want to be a surgeon, but you know what? Now I think I want to be an RN. That's what it's about. It's about giving you that opportunity to have an experience while you're learning the basics of anatomy, physiology, so that it's giving you that baseline and giving you that foundation from which to build a medical career. Hope that helps.
Fantastic. Our next question: does this program cost any money?
No, the program does not cost any money. Tuition is covered by the sending school. The only real cost associated with the program would be obviously appointments for your shots and so forth, but also the uniform that is purchased by the student.
Thank you, Dr. Palmer.
And actually, could I add a little thing in there? I know that the students who go to the Catholic schools, so Bonner Prendy or O'Hara, you actually get a little bit of a discount on your Bonner Prendy tuition, since you're taking this course and it's being subsidized by your school district. So just an FYI.
Thank you so much. Our next question, do you teach about pediatric care, or is there a pediatric shadowing opportunity when you go to the hospitals?
I'll take that question. It depends on which hospital you are shadowing in. Some of the medical facilities have a pediatric unit and some do not. So it's really going to depend on where you're located. However, saying that, if where you are situated doesn't have a pediatric rotation, and I'm speaking from Connolly because that's where I teach from, and they do not have a rotation in pediatrics, I make sure to include a lot of aspects of pediatrics into the curriculum. And we get to know our students, and we want to know what they're interested in so we can tailor our instruction to them. So if, for example, if I had a student who was interested in pediatrics, I would make sure I would be able to offer that student exposure. And there are opportunities that that will present themselves for that student. So absolutely.
Thank you so much, Sarah. Our next question is this offered in the Aston location, and would the students be required to provide their own transportation?
So again, this year we're at the schools, but typically we are at hospitals. And actually your school district will provide transportation even to the hospital. So hope that helps.
Thank you so much. With this program, are there any scholarships that we could apply for?
Yes, there are. There is a Taylor Foundation scholarship that's offered to students in Delaware County, but just certain sections and certain school districts of Delaware County. And they really like the med-career students, and they've given a lot of money to the med-career students, anywhere from, I think the highest amount, is it 5 or 7? I'm not positive. Or
Used to be 10,000, now it's like 7,500.
So, and we've had a lot of students that apply for this. There is an interview process with that. And again, when Ro was talking about the portfolio, now we are, we've moved into the 21st century and we have an electronic portfolio, rather than a binder. And they've brought that portfolio with them to these interviews, and they have gotten anywhere from, I think it's maybe 2,500 to 7,500. Does that sound about right?
Awesome. Our next question, are you allowed to choose which hospital you want to go to based on clinical rotations, or are you given a location based on where you live or your school?
Okay, I don't know if anyone's jumping in, but we usually try to do it geographically, if a school is close to a certain hospital. But I mean, we have some schools that sent to 2 or 3 different hospitals on occasion. We don't like to do that. It's pretty rough on the guidance counselors to do that, but typically we look at geography. If you live in Radnor or Haverford, you're probably going to go to like Bryn Mawr or Lankenau, it's just closer to that end of the county, and vice versa. So.
And bro, I can just jump in, add one more thing, is that districts usually try to transfer within a certain mile range. So in order to get transportation, they usually will not transfer only so far. So I think we try to be cognizant of that when we're doing our assignments for the school year.
Mm-hmm.
So we're going to quickly try to answer some of the open questions, and then we're going to wrap up. We did indicate about an hour for our presentation. I'll just touch upon one of the first items that I saw, just the level of the course difficulty and how does it compare to advanced placement courses. I know you have to talk to your sending district counselor, especially if you're one of your top ranked in your class and concerned about the GPA. Each district handles it slightly different, but honor weighted courses is a definite. I know at least one, if not several districts do count it as advanced placement quality course. It doesn't mean you get advanced placement credit, but they will weight it for GPA at the advanced placement level. So you do have to speak to your counselor about that. If you're interested in firefighting, the key item, you probably want to look at our emergency services. So that was one of the questions that was highlighted. Probably emergency services would be a good fit there. Maximum number of students accepted into medical careers. We have space for around 168 students in our current hospital settings. We are looking at the possibility of an expansion. However, we haven't made that decision as of right now, but we are looking at a similar enrollment to this past year, which was around 160 some students. Other people can join in, and then we're to wrap up. Any items people want to address?
If we go to Mercy Fitzgerald Hospital, which location would it be? I'm not sure I understand that question, but like Mercy Fitz can take schools from, you know, Pettenwood, Academy Park, things that are at that part of the county. There's another question here. The sophomore can't apply until her junior year. No, you apply in your junior year for your senior year. Again, only seniors.
Right.
So I'm gonna, I think she's asking what location the Mercy Fitzgerald, it's the Lansdowne location where the program is at. I think Springfield is a Mercy, is Springfield Mercy.
No, it's just Mercy Fitz. Yeah, no, Springfield's part of Crozier.
Right.
Yeah, Mercy Fitzgerald. Yeah, it's on Lansdowne Avenue in Darby.
Yeah. Is there any, let's see if there's anything in the chat. Someone had asked about being a pediatrician. Yeah, definitely, like we were talking about. I think we got all of them.
Yeah, and just that question, I know that Dr. Boots had covered it too. Firefighters, there's a program called EPS, it's Emergency Protective Services. They do like EMT and firefighter and things like that, but that wouldn't be medical careers.
Right. There's an open house, a virtual open house on Thursday for Thursday the 21st that will have that program information.
I would just like to, I'm sorry, Mrs. Quigley.
Sorry, there's a question here about ortho surgery. I was an ortho nurse, so I love ortho. They see a lot of ortho surgeries, hips, knees, shoulders, ACL repairs. And the question above that, hospital, what interborough students would go to, it just kind of depends when I don't know, depends, right? They've been at Fitz, they've been at Delaware County, they've been at Crozier. I don't know if they've been at Taylor, so it kind of varies, truthfully. Sorry, Sarah.
That's okay. I was just going to reiterate something Mr. Hansen said, that if you've taken science classes, bio, chemistry, and you're thinking about any type of career in healthcare, consider our program, ask questions, talk to your guidance counselor, reach out to one of us. What we're able to provide you in 1 year is such a great opportunity to learn so much about many areas of the healthcare field. So if you're unsure or you absolutely know your path, we can guide you, we can help you, and you'll have so much to experience and learn along the way.
Okay, so we're to, unless somebody has a final item they want to share, one of the panelists, we're to wrap this up, and I'm going to say thank you to everybody that joined in on this open house, all the teachers. Thank you for your hard work that you do on a daily basis with our students. Thank you for taking the time with this open house and the presentation. I want to thank our administrators and Ms. Cotton also, who assisted with this presentation, and all the parents and students. If you have questions, by all means, reach out to us. On our website, there's information of who to contact. Speak to your school counselor back at your sending district, at your home school. We have regular contact with them, and if they don't have the answer, they can get in touch with us. And and go from there. So thank you, everybody, for participating, and have a good evening.
Thank you, everyone.
Thank
Thank
you.
you.
Thank you.